Welcome back. I'm here at the Breast and Cervical Health Department and the main floor of Chinook Regional Hospital, and we're here to tell you about this new wonderful space, which was a $500,000 renovation funded by the Chinook Regional Health Foundation, and a real benefit to patients, and we're going to tell you why. But first, let me introduce Jason Vandenhoek, who's Executive Director of the Chinook Regional Hospital Foundation. Jason, tell us about the donation.
We're really excited to be here, obviously. The $504,000 that was used to renovate this space was actually proceeds from the Foundation's fund development programs over the past few years. So it's money that we've been able to accrue over the last number of years and align with this really great project, and we're happy to be here.
So convenient for breast and cervical health that this space opened. How did this space become open?
Sure. So what we were hearing is as Caroline will speak to, the breast health was in a space that was no longer suited to their needs, and we also knew that the colposcopy testing done in the Jack Eady Cancer Center was maybe not in the right location to best suit patients. So this all came together in order for us to have these services under one roof and to really make our patients feel comfortable and at ease when they have to go through these testings.
Awesome. Thank you. This is Caroline Martin. Caroline is a coordinator of the Breast and Cervical Health Program. Thanks for being with us.
Oh, you're welcome. Nice to be here.
So, Caroline, tell us about the old space, how it compares to the new space, and what you're hearing from the patients about the benefits.
Okay, we were in the old space 17 years, and we had 2 little exam rooms, a small desk area, a small waiting room, and an office, and that was it. And it was, we were kind of bursting at the seams. Mm-hmm. So when they told us that we might move us to this location, we were thrilled. And then to get colposcopy was even more fabulous, because then women could come to kind of one-stop shopping. They would get the breast and the cervical needs met in one place. So that's been great.
In a place that's just for women's health.
Right. Right.
Maybe we can explain to our viewers what colposcopy is.
Colposcopy is, women have a colposcopy when they have an abnormal pap test. Sometimes your results come back with abnormal cells, and then you might have another pap test in 6 months, and then the abnormal cells are still there. So your doctor will refer you to the colposcopy clinic. And all a colposcopy is looking at the cervix, which is the end of your uterus, with a microscope on wheels. That's what a colposcope is. It's a microscope on wheels, and the doctor puts some liquid on the cervix, and then the liquid will show, when he looks at them with the microscope, the abnormal cells on the cervix, and then they may do a little pinch biopsy of it.
Okay, so I assume those abnormal cells could be there for any number of reasons.
Oh yeah, and when it was over in the cancer clinic, people thought they had cervical cancer, and even though their doctors told them, they were just referring them there, and they were there because the gynecologists were there and the equipment was there. But now we have it here, and so it's a little bit less stressful because women are not going to the cancer clinic.
And not sitting in a waiting room with cancer patients.
Yeah, and the services we offer here are great, and the girls over there were fabulous, like the staff. So
yeah, it's quite easy to see from just from an outside perspective the benefit stress-wise.
Yes.
And
yes.
Convenience too. Mm-hmm. Anything either of you would like to add?
Well, I'd just like to thank the foundation, because we've got major feedback from the breast patients and the cervical patients, and they just really like the space. Yeah.
Thanks to the foundation.
Thank you, and we'd like to thank our donors. I mean, we have such an incredibly generous community, and time again we go to them and ask for funds, and they agree. And when we can enhance care and make it more comfortable for our patients, everybody wins. So we're really thrilled to be part of this project.
We'd like to encourage you to go to the foundation's website. We'll give you that, and also if you have any further questions about breast health and colposcopy, you can visit the AHS website for that as well. Thanks for being with us.